Hello, my name is Representative Pam Powers Hanley, and I represent LD9 in Tucson in the Arizona House. Today is February 7, 2022. It's a Monday. We had the House Health and Human Services Committee meeting today in the afternoon. The most controversial bill on our agenda was from Representative Joanne Osborne, who chairs the committee. I applaud Representative Osborne for bringing this up and allowing us to debate it fully on video for all to see, but I'm disappointed that she even proposed this bill. Basically, this bill adds the COVID-19 vaccine to the vaccine list that schools are not allowed to mandate in order to attend class. For the most part, the vaccinations that kids are required to have to attend school keep the school safe and keep the kids safe. So there are things for like measles or chicken pox. These are diseases that spread rapidly among young children. So Osborne and the Republicans are saying COVID is not a childhood disease, and so it should not be on the list. Well, the thing is, COVID-19 is a disease that will spread rapidly through a school if there are enough unvaccinated kids there. The Republicans said this was all about fear and parent choice, that the parents are afraid of the vaccine, the kids don't want the vaccine, this is causing so much fear in the populace, so we just have to take the vaccine out of the equation for small children. Multiple Republicans said small kids don't need it anyway because they don't get that sick. I did a point of order on that because I have two little granddaughters who are too young to get the COVID-19 vaccine. They were very, very sick for 2 to 3 weeks in December with COVID-19. The idea that children don't get sick is BS as far as I'm concerned. So I tried to correct them that, although they kept repeating the mantra that kids don't get that sick, so they should just shake it off. Just shake off COVID, that'd be fine. So I tried to say that as the legislature, we should not just be concerned about parental choice, we should also be concerned about public health. There has to be a balance between social responsibility and individual choice, in my opinion. So I said, we needed to look at the data. For example, Arizona is one of the worst states in the country for COVID deaths. We're like right up there in the top 2 or 3. And one of the Republicans said, oh, we're not talking about COVID, we're talking about the vaccine. Well, how can you talk about the vaccine without talking about the effect of the vaccine? It's obvious that most of the people who are dying from COVID are not vaccinated. So just a little bit of a reality check for the state of Arizona and the United States as a country. In Arizona, more than 26,000 people have died from COVID-19. Almost 2 million cases of COVID-19 in a state that only has like 7 million people. We're not a big state population-wise. Across the country, nationally, currently, 2,600 deaths per day from COVID. There have been more than 900,000 deaths from COVID in the United States. We're really one of the worst countries for death, considering how much vaccine access we had. Unfortunately, too many people don't want to get the vaccine. Also, nationally, over 76 million cases of COVID. The idea that the Republicans want to stop the parental fear of the vaccine and ignore the death rates and the astronomical case rates for the COVID it's silly, in my opinion. We need to look at COVID-19 and the pandemic. They're saying that eliminating the vaccine from school regulations is going to reduce fear of the school children and the parents. And I took issue with that. Those little kids probably won't die from COVID. They might get really sick. They're probably not going to die. But you know who's going to die? Their parents, their grandparents, their family members, their friends. This is going to strike fear in the hearts of those little children. I already see one of my older grandchildren sad because her friend was unvaccinated and got really sick. The idea that taking the vaccine out of the list of things that have to be given to school children, that's not the source of fear. People are afraid of this disease. They want to get back to some sort of normalcy where they can see their friends. Where COVID is going to be with us because we have not managed the disease properly. There's going to be rolling variants. There's going to be more death. But let's keep the children safe, and let's think about public health rather than parents who are misinformed about a vaccine.